A very good evening, distinguished faculties, colleagues, and delegates. It is both an honor and a pleasure to welcome you all to Madurai Shoulder Knee Conference once again, hosted by Dr. K.N. Subramanian sir and his team here in Madurai each year. So let me welcome. May I now invite TNA's President Dr. Subair Khan sir on stage, please. Let me now invite TNA President-elect Dr. Sundarajan sir on stage, please. IAS Secretary Dr. Rajiv Brahman sir. Special guest of honors, ISACOS President Dr. Joa Mendes sir on stage, please. ISACOS Secretary, Chief Guest Mr. T. Jayaseelan sir on stage, please. Today marks an important gathering in minds united to share commitment of an Can we have Dr. Krishna Kumar and Dr. Sasinder on stage all? Today marks an important gathering of minds united by a shared commitment to advancing scientific knowledge and innovation in the world of arthroscopy. In a world that is evolving rapidly, shaped by new surgical techniques, emerging technologies and challenges, the role of remaining up to date with the latest development is crucial. So let us start the inauguration program. I now welcome Dr. Sasinder to give the welcome address, please.
அனைவருக்கும் வணக்கம். கற்றது கை மண்ணளவு, கல்லாதது உலகளவு. What we have learned is a handful, and what we have not is equivalent to the world. With this timeless proverb, let us remind ourselves that knowledge is a long pursuit, and today is another meaningful step in that journey. Good evening to everyone. It gives me an immense pleasure to welcome you all to the MSKC 2025 inaugural ceremony. This evening is more than just a ceremonial inauguration. It marks the celebration of growth and collaboration and shared commitment to orthopedic excellence. When Madurai knee course started initially in 2019, it started as a very grassroots level meeting, but today it has grown immensely to a stature of an international arthroscopy society. Also inviting key opinion leaders from the ISACOS, which is the top international arthroscopy society of the world. We are positive with your support and blessings that MSKC is destined to evolve into a key international orthopedic destination in the years to come. We are deeply honored to welcome our chief guest, Mr. T. Jayaseelan, Controller of Defense Accounts, Ministry of Defense. We are equally privileged to be joined by the international key opinion leader, Dr. Joa Mendes, the President of ISACOS, welcome sir, and Dr. David Figueira, he will be joining us soon. He just completed a surgery. He is the Secretary General of ISACOS and a very good friend and mentor whose presence is a reflection of MSKC's growing global stature. Welcome sir. A special welcome to our national leaders, Dr. Subair Khan, President of Tamil Nadu Arthroscopy Society, Dr. Sundarajan, President of Tamil Nadu Orthopedic Association, Dr. Rajiv Raman, Secretary of Indian Arthroscopy Society will be joining us soon. and other dignitaries arrived here. The impact of MSKC goes well beyond what we can understand. It is quite similar to our Tamilian or Indian festivals. What happens in our festivals is there is a mini economy going there. There are a lot of people joining together, and it kind of boosts the economy of the country. Similarly, we have a mini economy happening here from delegates who travel from across the country to patients who will benefit immediately and over time from the people who have learned here to the industry that fuels growth and innovation. We possibly underestimate what impact we are making, but we should continue this for the years to come. As we join together to celebrate this festival, I also take this opportunity to thank Dr. K.N.S. sir, fondly called Dr. K.N. Subramaniam, for letting me be a very big part of this festival. I believe in relationships and collaborations, and I'm sure this event will be the formation and not culmination of collaborations. Orangati Urunal Vodalam, Kutangati Kodiyandu Vodalam. A lone man can run for a day, but with a united group can run for an eternity. With this Tamil proverb, again, I thank you all, and let us look forward to an enriching and inspiring conference. Thank you very much.
Let me invite Dr. K.N. Subramanian sir for the briefing of the event, please.
Very good evening to all. It's a pleasure to conduct this conference. And this is the 5th year we are conducting this conference in the name of Madurai Shoulder Nikon. And before that, we have conducted arthroscopy conference at a different name from 2013. So I have to say, we have State Society, for which President is Tamil Nadu, Dr. Subair Khan is there, and President-elect of Indian Arthroscopy Society is next to Sachinder, Dr. Sundarajan is there, and we have International Society of Arthroscopy, which is the society for the whole globe. The President-elect, Dr. Joe Espriguro Mendes is here. I don't think I can be more happy than this time, because we have at all hierarchy, the big people are in Madurai. Thank you, all of you, for being part of our program. And moreover, he humbly accepted. Mr. J. Seelan is actually, in his career, is a very high-level person who is based in Chennai, who is Indian Defence Account Service controller for it. And he accepted to come for as a chief guest for our program. Thank you very much, sir. Just to say a few words about arthroscopy. I came to India in 2012. 2011 and 2012 I came. From that time onwards, that time arthroscopy awareness, I think if you count from our Indian Arthro Society members number, it was around less than 2,000 only that time. But now I can tell you it's more than 4,000. I think really we're reaching 4,500 now. So you can see that much of growth, 2,500 members added up over a period of just in 10 years' time. And this growth over the last 3-4 years become much more. You can see that exponential growth. So that shows that awareness has gone very high. And during last conference I told that in UK, for a population of 6 crores, average number of arthroscopy that happens around 250,000. But in India, our population is almost 20 times of UK, but we should be having 20 times number of that, but we are not doing that many. So still we need to have more awareness. Still the arthroscopy numbers have to increase, and even in last conference I told that people should come and ask for arthroscopy, like now awareness of arthroscopy like that. Now they come and say that, sir, for laparoscopy they say laparoscopy, sir, laparoscopy. They have to go to the general surgeon and say, arthroscopy, mari laparoscopy you have to do, like that. For identification of arthroscopy, they always say, sir, laparoscopy mari pandringla? Like that they will ask. What I am saying is they should go to the general surgeon and ask, arthroscopy mari laparoscopy pandringla? They should have that kind of awareness that we need. That's what I am telling you, okay? And it's growing, it will grow further, okay? And another thing, very important thing that I want to say is, as soon as a postgraduate from orthopedics finishes, the first thing they want to look for is to go for subspecialty. And the highest competition is there in arthroscopy only now. I think you all agree with that. All those sitting in the dais and everybody will agree with that. Because that's what the scenario is now. Highest number of applications come for that because that is a shining specialty and the patient outcome in that is so good. That is why everybody is opting for it. And that's where the highest competition rate is there. And I always say that my fellows come and ask me, sir, there is competition. I tell that when there is competence, there is no competition. When there is competence, there is no competition at all. So for each of you, there will be a piece of cake left for you. Okay. With that intention, we started this MSKC program to teach a lot of people who are, to increase awareness, to have scientific evidence of what they practice, and they should deliver best practice to the patient. At the end, ultimate beneficiary of whatever you are doing is going to be the patients only. Patients who are suffering will have a best outcome so that they will have the last enjoyment. That's what we are all aimed to do service for the patient. That's what our profession is for, okay? And do the best practice. Only then you can actually be doing good to the society and you feel happy for yourself also. So with that, these 2 days event what we are doing today and tomorrow is based on knee and shoulder arthroscopy. And today we have done a live procedure of about 8 patients and tomorrow also similarly we are doing. And there are lectures, panelists. So I want you to utilize it to the full core and make sure you get full benefit out of this program. This I conclude. And we will be conducting every year like this and we want more people to come and join so that this arthroscopy will become much more popular than what we have now. And I also suggest everyone to become member of Indian Arthro Society. If you are already there, then not to worry. But if you are not, please become member of Indian Arthro Society and also become member of ISACOS also. There are so many things. Yeah, obviously. Yeah. The president is asking for TNAs. Yeah. Yes. Well, State Society, Indian Arthro Society and if you are a member for that, there are a lot of benefits there. You will see it once you go entering into that, you will have a big network of it. There are a lot of big works are happening. So become member of it soon if you are not. Thank you.
Now we'll have the traditional live platinum ceremony, please.
शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते दीपज्योतिः परब्रह्म दीपज्योतिर्जनार्दनः दीपज्योतिः परब्रह्म दीपज्योतिर्जनार्दनः दीपो हरतु मे पापं सन्ध्या
now invite TNA's President Dr. Subair Khan to deliver his speech, please.
Good evening, everyone. First, I should thank Dr. KNS sir for inviting me for this wonderful program for the consecutive 10 years. As he said, from 2012, 2013 onwards, he's been conducting programs in city of Madurai. And in fact, we were all the first members of the Tamil Nadu Arthroscopy Society when we started in 2015. And TNAS has grown to a very big level today, having more than 200 odd members. As I was saying, when I started my career in 20 years before as a postgraduate student, there was not much of fellowship opportunities for arthroscopies. There was not much of conferences. I was fortunate enough to do a fellowship there at the time. That was an era where people are more towards arthroplasty. Now we all know arthroplasty is also a part, but arthroscopy has become one of the mainstream in orthopedics. One thing we should remember, these CMEs are very important in delivering patients' outcome. So these conferences and programs, the seniors or senior faculties are sharing their knowledge and experience and expertise in the field of arthroscopy, knee, shoulder, and other areas, so that the delegates who are attending this can deliver this to your patients and give good outcome. So they always say, if you don't update, we'll be outdated, like that. So these programs are very useful. Without delegates, the program is not success. I've seen sir conducting in a small conference hall. Now it has become an international conference. First, I should congratulate him for making such a big event and consistently doing it for so many years. And moreover, I would like to thank the president of International Society of Arthroscopy and Knee Surgery, Dr. Joey Mendes, to coming all the way from Portugal to join us for this wonderful event. Thank you very much, sir, for coming all the way from Portuguese. And I want to end it with a small note. These programs are very useful for our future also. So you update about your skills. To end with, we all do surgeries, we do results, but I request all the delegates who are sitting here to please document and improve the research so that we also publish more publications, because you have seen Dr. Sundar here and Dr. KNS, they have done enormous publications even in India. It is still possible. We need to improvise ourselves by assessing our patients' results. So I all make a pledge that we all document all the surgeries and we assess the results so that we can give better outcome in the future. Once again, I thank you all and congratulate Dr. KNS for the success of this program. Thank you.
May I now invite TNOA President-elect Dr. Sundarajan sir to give a short.
Good evening, everyone. First of all, I want to thank KNS for having me here and also on the dais. And I'm associated with the KNS in all the conferences for the long time, all these years. And we know that magnitude of the conference, how it is getting bigger and bigger every year. So I should congratulate KNS and his team. I think his power is his team, his fellows, I think so many, especially from Tamil Nadu itself, that so many fellows are benefited by doing a short-term and long-term fellowships from KNS. So the one way of spreading arthroscopy in Tamil Nadu is I think the major name goes to the KNS than me, because even for me, I do a lot of long-term fellowships, like one-year fellowships all over India, but a lot of Tamil Nadu delegates, I mean, our postgraduates and the practitioners have been benefited with these short-term observerships and the fellowships. So that way, I'm happy to see that all these guys are doing, the front row, all the 3 rows are all KNS fellows, I know that, and they are also doing good arthroscopic practice. I think that is very, very important. As he said that the number of surgeries are increasing so much in arthroscopy, and awareness is increasing so much in arthroscopy. So I don't think that the competition is not a major issue, as long as the numbers are increasing, the number of surgeries increasing, and we know the growth which is happening for the last 4 or 5 years in shoulder arthroscopy, which all of us aware that numbers are not just we are doing ACL anymore. We know that we have the number of surgeries in the knee and shoulder are so many, and opportunities for the patients also getting benefited by doing all these conferences and sharing the knowledge with all of you. So you guys are also getting benefited, and patients are also getting benefited. So that's why these conferences are so important, and attending and getting benefited. And we are also getting more knowledge when we attend more and more conference. We are not reading the books. So whenever you go to the conference, usually I gain at least some knowledge in each and every conference. So I request all of you to attend more number of conferences. You don't need to complain that no more number of conferences are happening, but always it's good for us, especially for the beginners or the whoever practices. So it is the opportunity for us to come and clear our doubts, especially if you are practicing, then you can learn all the tips and tricks during the life surgeries. So it is very important to gain knowledge from all the theoretical and panel discussions. So that's why this conference is so great. And also, as Ken has said, that I am also so happy to see that Professor Mendes has come from all the way. It's because President and Secretary General, this is the first time we are coming to India all together. So that's a great occasion for all of us. And also as part of as a President-elect of Tamil Nadu Orthopedic Association, and I want you guys, if you are not becoming a member of Tamil Nadu Orthopedic Association, it is important that you should become a member. Yes, the President is not here. Now the President is Professor Manikandan. Manikandan has got lot of innovative ideas like scoliosis screening and DDH screening, which he is planning to do in major cities. I think that is going to get a lot of attention from the public also. So he is also creating a lot of social awareness. On behalf of Manikandan, then I'm conveying the message that program is going to be a long term, and it's going to be a successful program for all the poor patients. At the same time, as Raji Raman is not here, as the President-elect of Indian Arthroscopy Society, I want you all of you to become an arthroscopy members for Indian Arthroscopy Society. At present, we are having more than 4,500 members. It's the largest society after the Indian Orthopedic Association. And also, as he mentioned, so KNS mentioned, the doubling of the members happened in the last 4 years. When I was a secretary 6 years before, 7 years before, it's only 2,300 or 400. So within the last 4 or 5 years, it shows that 4,500. That shows that the interest and development of arthroscopy, and also from all the youngsters who shows a lot of interest in scopy. So this is a good sign for us also, a good sign for the patients, because of the knowledge when it improves. Of course, all of you are going to do a good work, so our patients are also going to get benefited. So with this, I will conclude my speech and also congratulating KNS for this successful program. Thank you very much.
May now invite speech of guest of honors, ISACOS President Dr. Joe Mendes to share a few words, please.
Ladies and gentlemen, good evening. I will start with a very special thank you to Dr. Subramanian for his kind invitation and outstanding hospitality. I'm coming to India since 1990. Some years I came twice, so you could understand that I can tell you that I feel at home in this country. India is an outstanding country with a very high-level culture, You have a fantastic system in education, very strong in mathematics, basic school, high-level universities. You already lead the world in some areas like IT, population, and the most beautiful part of it is that you are a democracy with respect of the human rights. And that's a big difference to other countries that also try to lead the world. As ISACO's incoming president, the World Society of Orthopedic Sports Medicine, I also need to congratulate the organization of this course, but especially all the Indian orthopedic sports medicine community. I'm a testimony how you improved during the last decades. It's outstanding to see what I see the first time I was here and what I see today. You are in the world level of the champions. So congratulations for that. For ISACOS, India is also a bet, because if you divide the world and you consider Asia, Africa, and Middle East, you are on the part of half of the world, and we should not forget that. And at the country level, for my presidency, is clear a bet. So please be welcome in ISACOS. Everything I can help in this country on my new position, I will be very pleased with that. Now I would like to share with you why this moment is very special for me. First of all, because many of you don't know, but many years ago I tested my ancestral genes. And my ancestral genes from my father's side are from the north of India. So it's my second country. And also because it's my first time in Madurai, but this is a special place for me. Very near Madurai, there is a city called Oriur, that it's a holy place for my family. There is a saint, a Portuguese saint, that died in Oriur, that I will visit his church tomorrow. And he was a saint because of a miracle. The second miracle was in a patient of my grandfather that was also an orthopedic surgeon. So I will be the first person from my family to visit that holy place for us. So thank you so much for giving me that opportunity. Thank you.
Let me share a few words about the chief guest now. In the light of current circumstances in India, we find it both timingly fitting to invite an individual whose exemplary civil service has significantly contributed to our nation's security and progress. We are honored to invite Mr. Jayaseelan, IDAS, to our conference as a chief guest. Your esteemed presence would not only inspire our attendees, but also underscore the value of dedication and service that are integral to our profession as well. Mr. Jayaseelan, IDAS, currently serves as the Controller of Defense Accounts in Chennai, overseeing audit matters of Army, Navy, and the Air Force units across Tamil Nadu, Kerala, and Pondicherry. He joined civil services in 2003 and serves the country for more than 23 years. May I now invite Jayaseelan sir to address the gathering, please.
Okay, correct. Good afternoon to everyone. I am Jayaseelan, Controller of Defense Accounts. So many people think so like a college going student is asked to put on the stage. I put 23 years service. In 2003, yes, I was a college student. I wrote IAS examinations. I cleared 261 in All India rank. One among 17th candidate cleared in IAS examination in Tamil Nadu. I was one of them. I born and brought up very rural family. I have given the interview in the YouTube channel also. If you browse it, Jay Seelan IDAS, you will come to know. When I cleared the IAS examination, I did not have the light in my home. Throughout my college, schools and everything, I have studied in the railway platform, Bodolu railway stations. Why I have chosen the railway stations? The railway station has only the three phase. None of the place have the three phase. It shows my perseverance, my hard work and dedications. If you want to quit something else, just you have to think about why you wanted to start that activity. That's why whenever I am reading, suppose I did not have the light, I can close the books, I can go to sleep. But main purpose, I want to succeed in my life. If I don't have the light, wherever the light is there, I go there. That's why I went there. That's lead to me into the level of the success. So thanks to Dr. Subramanian, he has find out me somewhere else through internet, through friends. He has asked me, this is the first forum I am giving the speech on the doctors and the medical field. Otherwise, I used to give the speech for only schools and colleges. Even of course, I motivate the doctors to become the civil service officers. Even the recently, this interview also that one of the candidates, Dr. Radhakrishnan's sons, Arvind Radhakrishnan, he has cleared the civil services. We have trained for these interviews. So one side I am motivating the doctor to join and the civil services. Here I am motivating the doctor to be in the doctors, because doctor profession is a very, very important. Because the doctors give the heart before the prescriptions. The best doctors prescribe the love than the medicines. Love is the best medicines. The one of the person asked this physician, if you are saying that love is the best medicine, if you don't work, what can do? He prescribed, give the overdose, because ultimately love is very, very important. 75% is intelligent, 25% the what you are giving the words to the patients. That's very, very important. Because the confidence level, if you increase the confidence level and awareness among the patients, that will be the greatest achievements. The arthroscope, today that we have found out arthroscopic associations, arthroscope, it's how is involved. What is the best doctor, what is the best forum? If any doctor tells the three things, he will be considered as the best doctors. Number one, declare the past. Number two, diagnose the present. Number three, foretell the futures. If you meet the three conditions, you will be the recognized excellent doctors, you will be recognized as a god. In the arthroscope comes under the second category, diagnose the present. Because in the traditional way, if you have any ligament injury or tendon damage, the doctor generally advise take for 2-month rest, 3-month rest. If you are the best sports persons, if you are selected for the district level, if you want to attend the state level, next 3 months is competition is there. If the doctor advises to take 3 months, 4 months, 6 months, your dreams get killed. So you cannot tell this foretell, you cannot diagnose the present situations with the immediate time, with accurate. In the arthroscopists give these solutions with a small incision. Exactly the doctor come to know what is the inner damage of the shoulder and the knee joint. Better he can advise, he can suggest within a week, within a month, within the 2 months, you will get 100% cure, you will come to right track as an athlete. That assurance can be given. That level of the hope, once how he can concentrate on this domain area. So today is a developed nations. The miracles happen in the medicine once you imbibe the positivity. Your thoughts should be a more positive because the positive thoughts become your words. You should have the more positive words because the positive words becomes a behavior, good behavior. You should have the good behavior, positive behavior because behavior became the habits. You should have the positive habits because positive habits become the destiny of you. So one should have the positivity. For examples, if you treat these two patients in the two different room, hypothetically you send these 50 peoples, each and every day 5 peoples. The 5 peoples went to that patients, that tells, I think all the doctor is telling you are very sick, you may die in 10 days. If continuously, if the 5 persons tells to them 10 days, 11th day the person may go to ICU or may die. Even if you treat the ICU patient, you send this 10 candidate, 5 candidate, every day an ICU patient, you tell them, yeah, all the doctor says you are absolutely fine, you will come out in the miseries, you will be a healthy person. The ICU patient shows a remarkable improvement because mind is a fantastic. So mind only is programming each and every body. All the memories, it's stored in our brain as a Kyrie and Celsi. So once you inject the positivity, they will dig out all your positivity, bring up, they will make you are the fittest persons. Recent research studies also explained so many things. You see, some people have this, some habit. Even some of the things, every day we are also realizing. When we have the dream, some people are kicking the leg, running, showing the hand, crying. The moment you wake up and ask them, what are you doing? The people are telling the snakes was about to bite me, I was running. During the sleep also, even the snake's bite or any other person threaten you, your body movement showing the reactions to the dream. Ideally, you are sitting or sleeping in the room. Because of the dream, your body movements happen to escape because the brain is giving the reaction. Brain doesn't know which one is fact, which one is dream, which one is lie. Even the input given to the brain give the instruction to the body organization, you react accordingly. That's why even if you are having the dreams, if a snake is going to bite, you are running, you are shaking your hands and leg. Brain doesn't know which one is imagined, which one is reality. So even if you are going to die, give the positivity to the patients, you are going to get improved, you don't have any other illness, absolutely you are right. Even tell the lies to the patients. The brain take the input. He radiates to all the cells, gets immunicated. So the doctor profession is a very, very important profession. So treat the patients with love and affections. You will get 100% awareness, 100% success. Then professions, that one of the, I will tell the one story and then I will complete my speech. Which one is the best professions? Someone like, someone doesn't like. Everyone want to do this doctor. After you enter into the doctor, somebody doesn't like, no, yeah, I don't want the doctors. I don't like their professions. Which one is the best professions? One of the teachers and the doctors, they met sometimes, they have discussed. The teachers told, so many students has come, some students bright, some students doesn't bright. They are making so many mistakes. I lost all these patients. Every day I am shouting, I am getting the BP because of my students. The teacher profession is not at all good, but your doctor profession, you are so fantastic. You are going with this neat dress. You are working in the AC rooms, so fantastically doing all those things. The doctor said, no. So your job is best because every day I am going, I am changing my coat, I am wearing the gloves, I am cutting exactly, I am doing the same things. Each and every patients I am treating, I am cutting, I am blood, I am handshake, washing, so many things are there. I am not like these doctor professors. So once the both of them went to the one Guruji, he is the right person to judge the peoples. They asked who is the best professor, which one is the best professors. The Guruji asked two peoples. They told, if all the students are bright, 100% accuracy, everybody is getting the 100% mark, still is it necessary to have the teachers? They said no, then there is no teacher role. Then they asked, if all the human beings are 100% healthy, they doesn't have any illness or worries, is there any role of the doctors? They said no. Because someone has the lapses, someone has the minus, someone have the defect, the defected people are coming to you. You are having the ability to treat them, you are having the ability to correct them, you are having ability to convince them. You are doctors and teachers. That God has given this talent to you. That's why if as long as people are with minus and grievances and defect, so you should have the talent. That is a profession. They asked, if you don't know any other things, doctors, what can you do? They told, I don't know anything else other than the doctors. So that's what, this is the highest professions, so enjoy it, they told. So that your services to the human being is a excellent services. Once Mahatma Gandhi said, which one is the best professions? He said, any person lose his sacrifice to other welfare. Anyone lose himself to make a happy of other person. Anyone make sacrifices his life to make other person's happiest life. That person services profession is an excellent one. That's sort of the doctors and medical field professions is excellent professions. So this is services to the mankind, is a services to God. Thank you very much.
I thank Mr. Jailaseelan sir for his inspiring speech. May I invite ISACO's Secretary, Dr. David Figura, to give us a short speech, please.
Hi, everyone. I'm not a good speaker as my previous speaker. But first of all, I would like to thank all the society and the people that are here, the attendees, the professors, and of course the organizers for this kind invitation to be in this meeting. It's my first time in India, and probably I'm regret of not having been here before, because I've received many invitations to come before and I couldn't for different reasons. It's not easy to be here for us from Chile. It's a long trip and we have to leave many things, many commitments there. And of course, I'm here because Kien insisted and Sasi insisted too. I received many mails and WhatsApp every other week for both of them to come here. And once I'm here, I really have discovered this wonderful city, this wonderful country, and these wonderful people. Me and my wife, we are very, very thankful of your reception, of your kindness, and your welcoming. And I was thinking, when I listened to my previous speaker, I think as human beings, we have many obligations to be the best, to do our best in our life, to follow our dreams, to accomplish our dreams. But as orthopedic surgeons, we have more commitments. We have commitments with our patients. We have commitments with our students, with those that come behind us. We have a commitment with our mentors, and we have a commitment with our students too. The arthroscopy has been learned since many years as a tutorial kind of teaching. So you that are mentors have to be grateful of that and to teach the guys that are coming behind you. That's very important. I mean, education has been part of my life for many years. And after my 60s, it's my first time here enjoying your beautiful country, enjoying your friendship, and nothing else. Just say thank you for everything that you have given me to me in those 4 days. And thank you for receiving me so kind. That's it. Thank you, sir.
Now we'll have the special talk by Dr. K.N.S. sir.
I'll only take 2 minutes. It was one of the dream for me to train a lot of arthroscopic surgeons, and over the last 10 years we had about around 60 fellows who have come and trained. But the more important thing was it was a dream for me to compile everything as a book. And that one is coming to reality now with the support of Dr. David Figura and Dr. Sasinder. Both have taken the initiative. The Sasi is actually main initiative by which we are creating a book by the name of Atlas of Arthroscopy. And it is not existing at the moment. I don't think there is a book called Atlas of Arthroscopy at the moment. So we are going to create it first. And we have an agreement with Springer Nature. We have signed a contract with them, and it will be published next year. And we are going to have 220 chapters, and each chapter will delicately tell about individual step of a procedure. And out of which there are 21 sections in that book, 11 sections in the knee, 10 sections in the shoulder, and each section has got many chapters. And out of 220 chapters, we already have 110 chapters submitted to us, and we are waiting for more submissions. And we are thinking that we will get this book published next year. It will be a nice one for everyone to read. I have to thank, there are so many authors already sitting here for that book. Already so many have submitted, and I thank all of you, and we are going to conduct a separate event for that also when you are publishing that book. I thank Dr. Figura and Sasi and every one of you for making me to compile this book and to release it in future. Thank you very much.
I now request Dr. K.N. Subramaniam to felicitate the faculty who have come from across the world and across the country. So we start with Dr. Joe Mendes. Dr. K.N. Subramaniam, could you felicitate? Next, I request Dr. David Figueroa. We would like to felicitate you, sir, for coming down. Dr. Zubair Khan. Our chief guest, Mr. Jai Sheelan. Dr. Sundarajan. Dr. Sasinder. Dr. Rajkumar Amravati. I now request Dr. Zubair Khan to felicitate the rest of the faculty. Dr. Uday Murthy. Dr. Vinay Kumar Swami. Dr. Prajwal. Dr. Prajwal. Dr. Manik Chandra. Dr. Amrish Kumar Jha. Dr. Prajwal Ganesh. Thank you, sir. I now request Dr. Sundarajan sir to felicitate. Dr. Chaitanya. Dr. Hemant. Dr. Nandakumar. Dr. Milind. Dr. Milind Pimprikar. Dr. Neha. Dr. Jyoti Prashant. Dr. Shivakumar Mani. Dr. Sriram. Thank you, sir. Could I ask Dr. David Fugaro to felicitate? Thank you, sir. Dr. David Fugaro can felicitate Dr. Vasan. Dr. Harish Chandran. Dr. Harish Chandran. Dr. Vanaj. Dr. Purna Chandra. Dr. Sendil Kumar. Dr. Sanjay Garude. Dr. Vinay Kumar Swami. Thank you, sir. Could I ask Dr. Joe Mendes to distribute? Dr. Naveen Kumar. Dr. Samandeshwari. Dr. Sandeep Lenka. Dr. Vignesh. Dr. Vignesh. Dr. Vignesh. Dr. Sandeep Kanagula. Dr. Satish. Dr. Deepan. Dr. Mithun. Dr. Krishna Kumar. Dr. Harish Chandra. Dr. Muthu Kumar. Dr. Arvind Ravichandran. Dr. Arvind Ravichandran.
Dr. Bharat Raj. Dr. Manivannan.
Thank you, everyone. At last, I would like to invite Dr. Krishna Kumar to give the vote of thanks, please.
So, good evening to everyone who all gathered here. So, it's my honor and privilege to deliver the vote of thanks on behalf of the organizing team. Today has been a remarkable event made possible by the support, participation, and dedication of many esteemed individuals. First and foremost, I extend our deepest gratitude to our organizing chairman, Dr. K.N. Subramanian, for his visionary leadership and timeless efforts. Your commitment has been the cornerstone of the program success. A heartfelt thank you to Dr. Subekan, President of TNAS, for your continued support and for gracing this occasion with your presence and encouragement. I also extremely thankful to Dr. Sundarajan, President-elect, Tamil Nadu Orthopedic Association, whose guidance and active involvement have added a great value to this gathering. Our sincere appreciations goes to Dr. Joe Mendes, President of ISACOS, and Dr. David Figaro, Secretary of ISACOS, for joining us and sharing international expertise, which has significantly enriched our academic experience. A special thanks to our chief guest, Mr. Jayasilan, IDAS, Controller of Defense Account, Ministry of Defense, for honoring us with your presence. Your words and support have truly inspired all of us. We would also like to extend our sincere gratitude to the Bharati Infinity Hospital for facilitating the life surgery and immense practical value of learning to this event. Last but not least, a big thank you to all the delegates, faculty, sponsors, and organizing team members who worked behind the scenes to make this event a grand success. Thank you all once again.
I request Dr. Joe Mendes to felicitate Dr. Subramaniam. I request all the faculty to stay back on the stage, along with the rest of the faculty and delegates for a group photo. All the remaining faculty and delegates who are in the hall, please come on stage for a group photo. First, we'll have all the faculty. All the faculty on the stage, please. Some will have to stand in the back, someone in the front. The youngest faculty, we have the youngest faculty.